Tamara. O negative blood. A universal donor and universally delicious. Let's see how she's tasting today, especially after those new vitamins. Nice and tangy, a little bit sweeter. That's more so the flavors we're looking for. Yes, very good. I'll make a note of that. Perhaps a little bit more, I wouldn't say iron, no. I think she needs a tad more magnesium, yes. That's it. But she's tasting rather good. Okay, Tamara, I'll save you for later. I think we have a client coming in, or should I say a patient, or a guest, whatever we call them. A snack. Hello there. You must be pardon me, was it Jeremy, or what was the name that you wanted to go with? Right, yes, they let me know that you might be paying me a visit today. I can see you have a little bit of a bump on your head and a few scratches, you poor thing. Yes, in your file they said that you took a little bit of a tumble out in the maze. You were chasing after Clarissa, was it? Old friend. I see. It's important not to frighten the other guests. We're all just a team, a family. And it's not kind to frighten your family, is it? No. Plus, Clarissa's very sensitive. She's still getting used to her new eyes that I put in, and some of the other changes that I made to her. Did you notice how beautiful she's looking? She looks fair. Well, there's nothing wrong with that. Perhaps she just needs some more iron in her. Maybe she's losing a little bit of it or whatnot. Can't be certain, but I'd be more than happy to take a look at you. See how everything's tasting. See how that bump is doing and those poor scrapes. Yes, well, we can definitely clean you up, and with every patient we always perform quite in-depth analysis. Yes, just to make sure that all our guests are thoroughly enjoying their stay here at the Moonlight Manor, and as the nurse, I of course want to take the best care of everyone, so why don't we get your file, okay? Good. Yes. Pardon me? Oh no, I was just having a little snack. Did you see that? Oh, no. That bump on your head, you must be imagining things. It was just a juice box is what it was, yes. You poor thing, you must be hallucinating. Okay, let's see, so Jeremy or Stephen? Yes, Smith, was it? Okay. And do you have any allergies, just so I know right off the cusp? Okay, I see. Right. Okay. So you remember that at least. That's good. And so do you want to kind of replay the events you were chasing after Clarissa? Did you get in an argument or anything? It was about her kids. Ah, yes. I remember the little ones. Yes, they always taste the fresh kids, yes, it can always be hard bringing up children with parents, probably some unresolved traumas there or whatnot. You don't want to bring those things up, right? You wouldn't do that to a family member, a good friend. Plus, Clarissa probably doesn't even remember much of them anymore. So, you were running after her and you fell. You scraped yourself, was it? Or right. A bump on your head. Let me just check. Ah, yes. Okay, that's from when they were dragging you down the hall and hit your head on the wall there. And you were putting up quite a fight, so they said that they had to... Yes, okay, let me take a look. Ah, your wrist. Yeah, they did have to. Okay, I see that. It's important to always listen to the hostess. They do such good work making sure the Moonlight Manor is up to standards for all our guests, so not listening is just rude. That's why they had to use some restraints, but clearly they worked because you're much more cooperative now, aren't you? Okay, so that's what we're dealing with, and they want me to specifically take some blood because they said that you were feeling a bit lightheaded, which, although could be from the bump, I think it's probably a lack of some vitamin or something, a little bit of a deficiency, but I can fix that. I'm really very good with blood. I was just drawing some up this morning of the other guests. What do we have here? Yes, Robert. He's older. He loves playing the elevator game, though. His blood, it's O as well, but I find that the older O isn't quite as flavorful as the younger O negatives. That's why I save her tomorrow, but always good to have backups. You never know when there could be a drought. The weather, that is so unpredictable. Okay, so it's nothing to be concerned about. We take blood samples of all our guests to make sure that if anything, were to happen, God forbid, we have blood for a transfusion or whatnot. We wouldn't want a repeat of 1989. That was quite a horrible year. Yes, there was a drought, and then we all were starving, and when you're hangry, how it can get. Okay, and do you have any other concerns about your health? I mean, we've gone over allergies, but any other illnesses or sicknesses I should know of? Right, let me just... Okay, I see here. Okay, we'll make a note of that. And we can always take some blood samples and adjust your meals and vitamins afterward. Okay? Well, let's first maybe clean you up a little bit because, for me personally and a lot of the other family staff, we always like a well-kept meal. Food always tastes better when it looks more presentable. And right now, my dear, you are not presentable. So let's just clean you up a little bit, okay? Okay, now do you have any fears of needles or anything that I should be aware of? Well, don't worry. I can be very gentle and I'm not too intimidating, okay? I even hid my fangs for you. No, nothing. Okay, now I'm just going to first take a look at your vitals, and I don't even need a stethoscope or whatnot. My hearing is Very good. So just relax for me, okay? Everything's fine. You're safe, okay? Let's see. Okay. Breathe in for me. And out. Good. And in for me. Out. Clear lungs. And a strong heartbeat. Yes. It's going to be delicious. Rather impressive, but considering your age, I'd expect nothing less. Okay. Good. Can see this bump here. Got a little bit of bleeding actually. We can work with that, yes. Okay. Luckily you're not going to need a stitch. It's good because we wouldn't want too much blood loss. I mean, that wouldn't be good for anyone. You'd be lightheaded and we'd be losing out on a good meal. Okay, and let's take a look at these cuts. Oh yes, I can see here. What about this side? Not as bad there. A little bit of bruising, but okay. Just lift the head for me. I'm just gonna feel underneath. Okay. No swelling there, which is good. No signs of infection. Swallow for me. Good. Okay. Everything's clear there. Do you mind just following my finger for me, please? Just follow my finger. Side to side. Good. Down. Cross. Up. Good. Back to center. Other hand here. Do 2 fingers now. Okay. Cross. Down. Cross. Up. And back to center. Good. I want you to only focus on this hand, not on this hand, okay? Good. Only focusing on this one. Good. Good. Okay. I can see your one eye is struggling a little bit. Could just be some trauma from the bump. I personally like an intelligent meal, but others aren't so picky. Okay, let's just take a look at your eyes. Just look up for me. Good. Okay. Honestly, you might have a little bit of astigmatism. Were you aware that your eyes were maybe struggling a little bit? Well, you don't have your glasses. You lost them in the maze. Oh, silly. You should have told me that. That makes more sense now. Okay. And just breathe in for me. Out. Oh, good. Take a look at your ears as well. Just look that way. Good. Take a look at your ears. Okay. Very clear there, which is good. Other side. Yes, this one here a little bit clogged, a little bit of water actually in this ear. Some fluid I can see. The fluid looks to just be perhaps, some water in there. Doesn't look like a sign of infection. Perhaps just a little bit from when you fell on that side. But I'm glad that they didn't hit you too hard against the wall there with that bump. It can be so hard dragging a body. So they did their best, of course. Concierge, it's much easier lifting a bag with a handle. You get it. Okay. Why don't I clean up these cuts for you, okay? Pardon me? Oh, no, that's, this, face paint is what it is. Some sometimes when we have the kids in here for, career day, they like to paint is all. So nothing to worry about there. It's quite normal, really. Okay, so just going to get some disinfectant for your arm there. Not too bad again. Like I said, you don't need any stitches, so you'll be okay. Don't worry. You're in very, very good hands. I would never let anything happen to you, okay? Never. We would never want any of our patients not feeling safe, of course. A worried meal is an untasty one. I only like so many undertones of fears. The anxieties can give more of a slimy taste. Okay. Oh no. Tamara accidentally leaked a little bit. Do you mind if I just... Oh, trust me, it's a very standard medical practice. More of ancient medicine, you could say. She's one of my favorites, but can't let any more go to waste, so let me set her aside first before I clean your cuts. You'll be fine, just stay here. Okay, I'm just gonna delicately clean these wounds for you. Just relax for me, okay? Poor thing, you must have been so frightened out there. Oh, I can only imagine. Was the fog rolling in? That's always the worst. It can be so scary, even for us. Poor thing. Well, it's a good thing you're safe. The last thing we would have wanted is a good guest to go to waste. Good. Okay. Oh, these will heal up just fine. Don't you worry. Good. And I can put on a little bit of ointment on them as well. Look at you. You're very, very special to us, okay? Never forget that. Clarissa was very special to us too, and she still is, and she's doing just fine. I know you're writing that little article for your journal or paper, whatever it is, but I want you to remember how caring we are here at the Moonlight Manor, and sending an article that would shed a negative light on this group would not bode well in your favor, and you've only just started your stay, and I'm sure you don't want it to end early, okay? Just remember that. You're in good hands, but you're in my hands. Okay. So, with that said, we will just dip into our little first aid kit. And I'll put a little band-aid on that cut of yours on your arm. Some of the other scrapes, they don't need bandages. We'll just put a little cream, okay? It's just the one that's a little bit bigger. There you go. Okay. Good. Okay. Should have a bandage in here for you. Probably not any, strawberry shortcake or Hello Kitty ones, but one that will do for you. You poor muffin. Okay. Let's see if I can. The thing with these gloves is they always make it so tricky. So give the blood a little bit of a latexy taste, which I don't love. Okay. toss that over there. Don't worry, we'll have one of the crawlers clean it up. Have you had any visit you yet? None yet. Oh, they're probably a bit shy, but don't worry, they'll come and pay you a visit. They always do with the new guests, especially because you're on the first floor. Always make sure to lock your windows at night. You were told that. Good. It's important to listen to exactly as we say. Okay, there you go. So, good there. Now, in terms of your treatment for your bump there, I want you to be taking some medication, okay? These little pills here, they're going to help with your healing process. Basically, they'll just make sure that you're getting all the vitamins and nutrients that your body needs, especially since it's been compromised and out in the maze. It was probably cold and dark, so who knows the internal traumas and stresses that you've been put through, okay? These will make you feel a lot better, a lot better, a lot better. Of course, they have some side effects. You might find yourself a little bit more groggy, sleepy, confused and dazed, but all of that's normal, so not to worry, okay? Okay, now I also want you to be taking these, okay? These are adorable little iron tablets. Have you taken any iron tablets before? Well, it's never too late to start, and we all know how important iron is for blood, of course, and we want to make sure we have those white blood cells up. They contribute a lot to flavor. These will also help combat some of that fatigue you might get. They have vitamin C, B12, folic acid, and they have incredibly fast absorption, which is what we want because, well, we just want you feeling your best as quickly as possible. Okay? So I'll make sure that you're taking those as well at breakfast and with the other guests. They're on similar treatments and meal plans, I should say. Of course, that's one of the best part about staying here at the Moonlight Manor is all the food is included. For me as well, it is. Okay. Well, only a couple extra little notes here to do. Just going to clean under your fingernails slightly because I see that they're a tad dirty. So, do you mind if I just give them a little wipe? Thank you. Just a little scrub, okay? Good. How long have I been here at the Moonlight Manor? Oh, well, I could tell you about 182 years, or I could tell you 3 years, yes. But in this short time I've been here, I've made such an impact, and they really adore my work, my treatment plans, and how I care for all of the patients that come into my nurse's office. I treasure everyone that walks through that door, and I treasure everyone that gets carried out. I think you and I have gotten along just fine, don't you agree? You've had some fighters before. That's no fun. I hate breaking a nail. And there's no really appetizing aspect of a sweaty meal. I don't like salt that much. I have more of a sweet tooth. Oh, you like a sweet treat after a meal as well? Well, maybe that's something we can agree on. Okay, good. Yes, isn't that much better? Dirty nails are always so icky. The only time you'll catch me with dirty nails is after I've been in the office all day, or after I've played with my food, which you're not really supposed to do, but you know, when you're young and excited, it can happen. I love games as well. Do you love games? What's your favorite game? Oh, I don't think I've played that one before. Maybe you can show me later, but first you'll need to rest, okay? Have you played the elevator game with Robert and found the basement? Oh, well, my favorite, hide and seek. Yes, it's always so fun, and you never really know who you're gonna find. Okay, I also noticed you just had a few stray hairs, so why don't I just get those for you? Okay. You can see how good we take care of our guests here at the Moonlight Manor. You see that, don't you, Jeremy? Stefan? Whatever your name is. You see that? Yeah. I'm sure you see it a little bit less without your glasses, but it's okay. We can always have a new pair made for you if you'd like. Of course, it'd be no problem at all. Might take a couple weeks to get them in, but I have a feeling that you'll want to extend your stay anyways here at the manor. Don't you want to stay a little while? I mean, really, what does rural Pennsylvania have to offer anyways? Minneapolis? Where did you come from? I always forget. Yeah, see, nothing really out that way. You'll be much better here. And we can even get them made at the nearby town. Oh, has it vanished? No, I can't remember. You see, thing is, I'm often here in the clinic, so perhaps I'm getting it wrong. Anyways, I would listen to the front desk managers and hostesses about the more geographical aspects around the area, because I'm inside so much, tending, caring for our food, patients. I don't get out much, but that's okay. I love staying inside, and I eat a lot. Yes. There's nothing better than a good meal. That's why my skin glows like this. That's why yours will become quite pale. Gaunt. But we'll take care of you, don't worry. Just enough life to keep you going. I don't know how much to keep you typing away that little journalism gig, but I'm sure you'll find a new hobby. Okay. Now, if you don't mind, I'd like to just take a little blood sample now, okay? It's really important that we do this. I can tell you're a bit stressed, so just relax, okay? Breathe in through your nose, out through your mouth. Everything's fine, okay? You're safe. You're gonna come out of this feeling brand new. I'm sure of it, okay? Especially once I give the kitchen your new meal regiment, your new little vitamins and pills. You'll feel so much better after those. Trust me. Okay. So, which is your more dominant arm? Oh, okay. Well, we'll do this one then. just relax for me here. Just to be a slight break. Oh, no, that's only in movies that you need that. You don't really need that. Good. Okay, perfect. Oh, I'll just wipe that a little bit. There we go. Oh, that does smell good. Okay. Control yourself. Good. Oh, that should be enough for a little sample, I'd say. So, with these results, I'll see what other aspects you might need to add to your diet. You might need some more vitamin C, vitamin D perhaps. The more we keep you here at the manor, the more vitamin D you'll need, of course, because you'll lack sunlight and exposure. But I'll take that blood for sampling and we'll see what it says. Then from there we can begin the harvest. Okay? We have such a big feast coming up for Halloween night. Are you excited? Oh, there's nothing to be scared of. There's nothing too spooky here at the manor. I think everything is very predictable. We'll see. Okay, everything's gonna be fine. If you need anything from me, just ask. Like I said, I care for all of my patients thoroughly. I mean, all of them have a story. All of them have dreams. All of them have wishes, stressors, and I think you'll find you'll fit in quite well with a lot of the other guests. But no one is exactly the same. But as you can tell, we don't have too many right now. I mean, of course, we have the storage rooms and the freezers, but if you want to call any of your friends, I think it was Andrea that they mentioned, those cute little bangs. I think it's probably best you might give her a call. Actually, here, why don't I just set you down? Why don't I just take her number down for your emergency contact anyways? It's standard procedure at any nurse's office, clinic, or hospital. Okay, so that was Andrea, and what's her phone number? Okay, I see. And do you know her email, just in case she doesn't answer right away? I mean, I'm hoping she can come tomorrow. The story I'm gonna spin up to get her here, but okay. And does Andrea happen to have any little ones? A younger sibling? How young? Oh, okay. Do they live with Andrea? Okay. She does. Okay, well, I mean, does Andrea have anyone that she would normally have babysit? Okay, well, just in case we need to give her a call, if anything, you know, it's always important with emergency contacts, but it can also be nice just for a family visit, and maybe you could have a little reunion. You dated for a little while? Oh, well, a little bit of heartbreak didn't affect the blood too much, so don't worry. Okay, well, I will help you get back to your room so that you can get your rest, okay? Is there any questions you have for me? What day is it? Oh, you poor thing. Look at you, feeling dazed and confused. I think it's time you get some sleep, okay? We'll wake you up when we need you, okay? It's important to stay in your room, and don't worry, I'll lock those crawlers wake you up. Sometimes they can be so annoying, and they even give me the creeps when they're on all fours. Oh, sometimes they'll hide in the morgue, and it's like, oh, seriously, I already have enough bodies around me, but... not here at the manor, of course. Why would we have a morgue at the manor? No. I volunteer. Yes, for the good of society. Okay. Well, why don't you come with me? I'll take you to your room, okay? Come on, we better get going. I can already feel a chill in the clinic, so I know it's getting late. Some cream for your arm? Oh, yes, well, it's getting late, like I said, and I have other patients to tend to, so why don't I pay you a visit tomorrow, and I'll have some cream for your arm, okay? It's best to let it just, disinfect